Today from chapter ENT Larynx we will discuss about stridor. So what is stridor and enumerate the causes of stridor. So stridor is noisy respiration produced by turbulent airflow through the narrowed air passages. It may be heard during inspiration, expiration, or both. Now discussing about causes of stridor. So it can be congenital or it can be acquired, and congenital stridors are laryngomalacia, laryngeal web, subglottic stenosis, hemangioma, tongue and jaw abnormalities. And causes of acquired stridor, it can be afebrile or febrile. Febrile means which can cause fever or rise in temperature. So causes of efebrile stridor are papillomatosis, injury, foreign body, laryngeal edema, adenotonsillar hypertrophy. And causes of febrile stridor: epiglottitis, acute laryngitis, laryngotracheitis, retropharyngeal abscess, peritonsillar abscess.